ki te Pacific Health Talanoa with Lorenzo on Blue TV. Happy te wiki o te reo Maori Aotearoa. Wow, what a pleasure to have an awesome guest on our show today. Mātua Thomas Edward Henry, who is the District Coordinator for Auckland Central Maori Wardens, to have a kōrero with us about the te wiki o te reo Maori, and also I'm going to be asking him some questions about the vaccination amongst our Maori community. Welcome on the show, Thomas.
Kia ora tēnā koe, tarangatira tēnā koe o tomotu o ko Thomas Henry tāku ingoa, ko nā wātene Māori o Tāmiki Makaurau. Nau mai, whakatau mai rā me te taitoko mo te reo Māori. E tarangatira e Landro e Pacifica, no reira hun mai mo te kaupapa mo te whānau katoa. No reira tēnā koutou a hui mai tātou katoa. Kia ora
No,
matua.
mai, haere mai. Kia ora, Thomas. Thank you so much for coming on the show. I know you are very busy, with the work that you do and the kaupapa that you lead for our Māori community, but thank you so much for your time on the show today. Now, Thomas, can you tell our viewers and listeners and our whānau a little bit about yourself first?
Tēnā koe, Lorenzo. Look, thanks for having me on your program. It's always good to be a part of our Pacifica. Pacifica is a part of our whānau, working and collaborating together, ways to go forward, because we are one people, one nation here in Aotearoa. And I'm just so honoured to be on your show today to share our whakaaro, to share our mahi. I know I've worked with you many times. I've done some emceeing with you, and you're passionate about the work that you do also. So certainly for me, look, our community is first and foremost. With this deadly virus that's around in our community, we're working so hard with all our kaumātua, our kuikui, that are very vulnerable and that are very scared at the moment, matua, in regards to they don't want to come out of the house because they're too frightened because they might get the COVID, or they don't have enough information, matua, about the information around this vital infection that is around. So we've been working very closely, and certainly with all the providers, the health providers. I know we've been working alongside all your staff and your medical staff in regards to getting our people just to get vaccinated. But the ones for us are our kaumātua, our kuikui, that won't come out of the house because they're either too whakamāti, too shy, or because they're too frightened that they might catch the virus. So Māori Wardens have been working at all the vaccines. You might have seen them working at all the vaccine centres throughout Tāmaki and throughout South Auckland. The Māori Wardens are working alongside all our Pacifica also, so that we can engage and say it is right to go out and have your vaccination shot. It is right. Don't listen to any platform or any other media that's out there. Just, we're here to api, to manaki, and make sure that you go out and get your vaccine.
Thank you so much, Thomas. Now, this week, Te Reo Māori is being celebrated in Aotearoa and the whole world. And I believe that Te Reo and Pacific languages and any language should be celebrated, every day. But what does this specific week for Te Reo Māori mean to you and the Māori Wardens organisation, Thomas?
I think for us, tarangatira, I think it just shows the true of taha Māori for us as tanu te whenua of this country, because that is our first language, is the reo. And having this today, that we're able to have a day of just talking the reo, it's a great honour for all of us, especially in the world of taha Māori, because it just shows that we're allowed to display what our ancestors, and like with our different cultures, especially with our Pacifica, our different Hawaii, and all these other different, they're the same whakapapa, they whakapapa just like us. And there's a meaning to why our language is so strong, because there's the wairua. And today, having a day of Te Reo Māori, it shows that I can show off my rangatira, my kaumātua, my ancestors that have left, that have built this place for us. It shows them off today.
Ka pai, Thomas. Now, I'm fully aware of the work and the kaupapa, the mahi that you do, promoting vaccinations for COVID-19. But I'm also aware that the number of Maori and our Pacifica people that have been vaccinated are very low. Now, can you share with us what are some other ideas or some other strategies that we could, implement to make sure that our people will get vaccinated, Thomas?
Well, we've just learned in the short time that we've been in lockdown for that the best way to people's hearts is kai. In the Maori world, kai. And if you can put that across certainly to our kaumātua, our kuikui, and just educate them around fires, it is safe to go out and get vaccinated. We're doing that right now. My room has actually been turned into a little warehouse. I've got toilet paper, I've got stuff that's going in and out, but it's going out because we're going out with food parcels to the community. So we've been engaging. Just over the last week, our rangatai was able to engage with our kaumātua and kuikui in some elderly units. And all they said to our rangatai was that, how can we get involved? We don't have the plague. We want to get involved. How can we help, Thomas? How can we give back to you? So we got them working, not moving from their home because they weren't allowed to come out of their bubble, but they were able to engage and make up 700 masks so that we were able to get them out to the food parcels and put them into the food parcels. And these elderly people, they were just so overwhelmed that they were able to do that, Lorenzo. So that's one way of us going and, taking the information and saying to them, it is all right to come out and get vaccinated.
Absolutely true.
Do you want us, the Maori Wardens, to come out and pick you up? Or do you have a way to go to get vaccinated? We can tell, what would you like to do? And that's us as Maori. We'll take our people to go and get vaccinated so that they know that are safe. There's some people in our community, Lorenzo, that have locked themselves away because they're just too scared to come out.
Ka pai mātua, Thomas. Yeah. Sorry, carry on, Thomas.
And I think the other good thing is what the government is doing at the moment. I'm hearing there's also now going to be transport trucks going out. Mobile vaccine centers, car probably. I would support that. I would support that and having those in our community because it comes with the information. So we're glad that we're hearing that at the moment. Just within a short 3 weeks, we've hit over 700 homes.
Wow!
And that's just within the short time of level 4 that we've been able to go out and take food out to kai out to those that are suffering. And when we go there, that's when we know that there's urgent needs some help with our kaumātua, our kuikui. They just don't want to come out there, just lock themselves in the home.
Wow.
As soon as you engage with them, talk with them, they soon open up. So I think there needs to be a bit more work. And you're right, it is low for us, especially for our Māori people, especially our Māori people that are in the rural areas too, because it's so far, they don't have transport. It's just the kaumātua and the nanny at home. all the kids are growing up. There's no one there to take them in.
Thank you, Matua Thomas. Now, are you able to share and kōrero with us? And I believe that you have some answers. What are some of the challenges, especially with Tamaki Makaurau, Auckland, being in level 4 lockdown for 5 weeks now? Have you come across any other challenges that our people, specifically Maori and Pacifica, are facing in this lockdown?
Work. The lot of stress around a lot of our whānau, Pacifica losing work. And you know, with our Pacific and our Maori families, they're not small families. They're families of 7, 8, and that's a lot of kai. Dad's lost work, mum's lost work, they've cut the hours down. There's not enough money going or generating. Something has to give this week. Is it the power or the rent? That's the stuff that we're hearing out there, Matua. There's no money in the house.
Wow.
No money because there's no work. Dad is getting frustrated. Mental health is now starting to settle into a lot of homes. Burglary. A lot of the kids are wanting to go out and start to do a lot of stuff that we see. And, you know, we want to capture that before that happens and say, hey, there is help, there is support, there are the agencies, and we need to be a bit more on the ground. There's not enough of us on the ground at the moment, and I think that's where we all need to be on ground zero, so we can capture what's going to happen.
You know, Thomas, having someone like yourself, you know, like a Maori leader being involved, heavily involved in driving this vaccination clinics, for example, in a marae, you know, a familiar venue, a familiar area, a location to our Maori people. Would you be open to working alongside our health providers, such as Tamaki Health, you know, local doctors, to deliver vaccinations to our Maori community?
I'd love to, and straight away you've just hit it, you know, hit it on the head, because that's where our people feel more comfortable. You know, at the marae, a cup of tea, a chat. There's people within their own age that they can talk to, rangatahi that they can talk to, people or whānau that are going through the same thing as them. They're not being isolated or being left out. If those can be set up, these Tamaki Healthcare or whoever they all are, all these organisations can set these up, then you'll have a bit more people going on to the marae. You'll have a bit more people going to get vaccinated because they're in a safe environment, they're around people that really care, and also around groups that can support them as they go through this transition around level 4. Having those wraparound services, as you know, Lorenzo, when we do a lot of community events, having you know all those services, so they can tap into those services, and that's what we should be doing. Bring all those services, MSD, bring all those businesses that are going to be looking for staff, so that we don't have the mental health, we don't have depression, we don't have shops being robbed. Our shops are only trying to do their part in the community. I'm spending more time at the shops chasing kids away because they're hungry. You know, and I'm just saying to the shopkeeper, I'll just give them a bag of chips, I'll pay for it. And that's what's happening. The supermarkets are getting targeted. People are walking out with meat. And, you know, soon if it's a Maori and a Polynesian person that's gone and done that, the manager says to me, Thomas, I don't want to ring the police, but can you, the Maori Wardens, deal with it? How can we help them? What can we do as a supermarket to give back? So these are all the collectives of working with different services. They don't want to see our people go to jail or get fined $89 because they stole something that was worth $2 something. You know, all this sort of stuff. And to have those wraparounds. Marae, apai. Apai te mahi tahi. That's where I think you'll see.
Yeah.
You'll see a bit more about people. Even with the whareas, opening up the whareas, you know, I would see a lot of our people going onto those places. It's happening right now in some parts of Tamaki ki Tatonga and Tamaki. I know Manerewa are already starting to do the rollout. Yes.
Thank you, Matua Thomas. Now, you mentioned earlier about the lack of understanding among specific and Maori community with regards to the virus and with regards to the vaccine and everything about COVID-19. Do you think there is a breakdown in the communications from the top level down to the bottom level where we are, where people like yourself, you know, like us, community people on the grassroots, do you think there's a breakdown of communications in these in these different levels?
There certainly is, Lorenzo. Certainly a big breakdown. There's not enough information that's shared to especially to our pakeke, our kaumātua, our kuikui, so they can understand the resourcing or some resource that should be given to them, or there should have been consultation on how this is working. Just going to talk to them, because that's what I hear goes, I don't know. We don't know. We've been told by other people that we shouldn't take this because it's no good for us, no good for our system, no good for our tinana or well. And if I think if there was a bit more information and getting onto ground zero and getting out there, and if the government would, instead of feeding more, places into our areas, get their people on the ground, get them into the infected areas so they can go out and spread the information, not put it online or go in. If you tap onto that, a lot of our people don't know how to work computers. They don't know how to talk to a machine. One guy said to me, they told me to ring 0800, but I don't know what I was supposed to do because it was telling me to do all these things. So, you know, making it easier, Lorenzo, for our people so that they understand.
Thank you, Matua Thomas. Now, with the system that's been put in place by the ministry to book a vaccine appointment, do you think the online booking system works for our people, or do you think, as a Maori leader, prefer to have our people walk into a drive-through or walk into a vaccination clinic and just get jabbed and leave? Which one do you prefer?
I prefer the walk-in. The walk-in is you feel the warmth, you feel the aroha. You know, with the 0800 number, I've seen people come myself, they're booked in and then been turned away because, and it's sad. I feel the one that I'm the one that told her to come through, and that's when I'm saying to her, I apologize. I didn't realize there was no more booking. But I had made a booking. It doesn't work. The system doesn't work. The walk-ins, I think that should have started from day dot.
Nice. That is a great advice, Matua Thomas, because I'm hoping that some health providers that are, implementing that system would be more open to the idea of letting people walk into the vaccination clinics and get vaccinated and go home. Thomas, is there anything else that you would like to share with our community today?
Look, I just want to say to our community, Tautotarangi Māria, he manaki me te koro ai mo te kaupapa, aroha ki te tangata, he tangata. It's about us, the people. We need to nurture. We need to start looking after all of us. We need to nurture our pakeke, our kaumātua, our kwekwe, and look after, check on our next door neighbours and to make sure that they're all right. We are here to help. Kia ora.
Kia ora, thank you so much. Ka pai mātua Thomas, thank you so much for your time to come on a kōrero. I really enjoyed our kōrero this afternoon, and I appreciate, commend and applaud, the mahi that you do with our Maori Wardens, and God bless you. And yeah, would like to have you back on the show one day. Kia ora.
Awesome. Tēnā koe te rangatira, tēnā koe he manaki me te koro wai mo te kaupapa o mo te mahitahi. Nō reira, tēnā koutou a hui mai tātou katoa. Kia ora rā.
Ka pai. Thomas Henry, the District Coordinator for Auckland Central Maori Wardens, with a kōrero about the Te Wiki o Te Reo Maori and vaccination amongst our Maori community. Kia ora.
Squad, baby. Rex, J. Sands.
Let's go.
Oh, say I'm a say you are complete to me, I get you. By the way that you move and the way that you smile. Say, oh my Dorima, baby, you be giving your hand, I'll take you anywhere. You give me something that I never had. Cause you care, but about to me and the family. Say, why you waiting on me to talk to you? Yeah, I'ma listen what y'all say. Yeah, don't move out in the come here. Yeah, they on the layout, oh, dirty wine, girl, dirty wine, yeah. Say, tama in, they not the fight to get out, say,